Welcome to 10-5, the official podcast of the OPP Association. My name is Scott Mills. I'm one of your hosts for our podcast. Emily Brown, our co-host, will be editing this episode, and she's not going to be with us for the duration of the recording here, so I'm recording solo. So, for new listeners, the OPP Association represents nearly 10,000 members of the Ontario Provincial Police in Canada. And that includes civilian members, that includes active members, and we also represent our retirees. Our members are at the heart of everything we do, and they are our greatest strength. And we're dedicated to keeping our members and the public informed about key issues that impact policing across Ontario, which often leads us to interview guests who are not actually our members, and that is the case today. Today we welcome registered nurse Michelle Marr from the Dufferin Mobile Crisis Response Team, known as MCRT, to discuss her role working alongside OPP officers collaboratively to respond to and actually prevent mental health crisis calls in Dufferin County. So welcome, Michelle.
Thanks for the invitation, Scott. I'm happy to be here.
And Michelle, I understand today are you at the Dufferin detachment of OPP? Are you talking to us from there today?
I am.
Okay. So in an episode a little while ago, we had OPP Provincial Constable James Giovanetti on as a guest, and he gave us a great overview of the Mobile Crisis Response Team program in Dufferin. He had some high praise for you, Michelle, as the full-time nurse, and Angela as the part-time nurse as part of the program. And I was just wondering if, to start off our discussion here, you can discuss a little bit about your career path that led you to do this collaborative work with the police.
Absolutely. So I've been a nurse now for roughly 23 years. I began my career in cardiology and then quickly moved over to pediatrics as a pediatric nurse in Dufferin County as well. I was in pediatrics for about 10 years. During those 10 years, I found an increase in mental health admissions and really kind of saw the need increasing in our area for mental health supports, especially in the youth. So I decided to specialize in mental health and addictions. And that led me for the next 10 years to working in an early psychosis intervention program in the community. And throughout my years in the EPI program, I actually did a lot of work with some of the local officers. Obviously, we did a lot of calls with them. So that kind of jaunted my interest in the assert program when the posting came out for an assert nurse.
And assert, is that the kind of mobile crisis response team? Is that how you guys say it, assert?
Yes.
Okay, perfect. And where? So I know you're Dufferin County. What, for people that might not know where Dufferin is, can you tell us like kind of what cities and jurisdictions that you're covering there?
So there's two Dufferin detachments. We have the Orangeville location, and then there is a second detachment up in Primrose, so we cover, Dufferin is quite large. Basically anything north of Caledon. So I would say we have Orangeville, Shelburne, Mono, Melanchthon, Grand Valley. I'm trying to think if I'm missing anything. It is quite a large area.
That is a large area, and I know from talking with James that you guys are quite busy up there, and so thanks for everything you're doing.
Thank you.
Can you share with us, Michelle, exactly what your job as MCRT or MCERT nurse entails?
Absolutely. So as a nurse, we ride along with, so I have a full-time partner who is a mental health trained officer. So our James has moved on to a new program. Actually, he'll be heading up to Aurelia in the next few weeks for a new position. So we now have Jordan Bernelli as our full-time MCERT officer. And then we do have trained officers on each of the other platoons. So when Jordan's off, Angela and myself would ride with one of the other trained officers. So we are in a car with them basically every day. And we attend not only the crisis calls, we generally attend any call. We're noticing, all the calls have some form of a mental health component. Our role is really to divert the crisis calls from going into the hospital, keeping people at home in the community, and delivering best quality of care during a time of crisis. So that could look, crisis can mean something very different for anybody, right? That can be a mental health breakdown. Let's say, we've attended a car accident and there's a witness to something that maybe, is traumatizing. We would help support the people on scene. We attend any of the mental health calls that are called in, and try our best to divert these individuals from having to go to the hospital. So that would entail, crisis intervention at the time on scene. And then we have multiple community partners that we would refer out to hopefully connect that person or individual to services in the community.
Thanks, Michelle. When we were chatting prior to you coming on the podcast here as a guest, I was asking you about some key messages that you would like to discuss, and you immediately responded. I'm just going to quote you because I'm like, okay, this is a big deal. And you said the huge message right now would be we are currently running with no program and funding. And that kind of scares me. Can you explain what you meant by that for us? Just for context, I went back and I listened to OPP Provincial Constable James Giovanetti's podcast episode. And when we asked him for his 3 wishes, his number 1 wish was sustainable funding. So, I'm just giving you the warning here before you never know who may listen here, Michelle. We've got over 80,000 downloads now in our podcast.
Wow.
And hopefully someone can hear you and be in a position to help you. And maybe in addition to what you meant by saying that, can you tell us exactly what you feel you need funding wise for the MCERT program in Dufferin?
So I'm going to say that will still be on our wish list today. It will. So the MCERT program is currently it's generally funded by the Solicitor General. It comes through forms of grants, and the proposals have all gone in at this point. We're still waiting to hear. So the Community Safety and Wellbeing Grant is which pays for the officer, right? The MCERT officers that are on duty. And usually the MCERT Enhancement Grant, which comes from Solicitor General, covers the nurses portion. So I can't tell you exactly for how long, but for the last little while, we've been working without the grant. So Headwaters Healthcare is currently covering the nurse portion of the funding while we await for that grant decision.
Well, that was very kind of them, and I assume that the OPP are funding the officers assigned.
Correct.
You pretty much, I think you explained kind of the history of the funding structure. To me, like just me talking off the top of my head, when I hear that people are getting funding by grants and things like that. Is that really sustainable? Like, is there a different way we could do this in your mind after doing all this work and great work it is over a number of years?
I think with like sustainable funding, it would be easier to retain staff. So I've been in this role just shy of 3 years at this point. And because the funding comes in, a 2 or 3 year term, it's very difficult to make it a full-time position, right? So that being said, a permanent position. So I'm working full-time, but it is under a contract currently. A lot of people really don't want to give up their permanent positions, right, to go on a contract. So I think that would definitely be more enticing, right? Should we need, additional staff and that kind of thing. Yeah.
Well, hopefully somebody's listening out there, and because we're going to get into a little bit about kind of what you do and how effective it is. So James mentioned in his interview the multidisciplinary collaboration that exists to not only respond to mental health crisis calls, but to actually prevent them from happening in the first place. And I was wondering if maybe you could describe some of the key community partnerships that you have in place and exactly how diverting people from the hospital actually works.
So we have many fabulous community partners that we couldn't do this job without. Like I said, part of the role is trying to connect individuals at the time and in a timely fashion, right, to get them connected with community resources. We refer out to multi-agencies, including like Canadian Mental Health Association. There's crisis services, Dufferin Child and Family Services, which we would refer most of our youth for mental health support. Family Transition Place, we work very closely with. We've got Choices, which is the youth and men's shelter, and they also have support services with them. So they are often a fabulous help in terms of, providing shelter for people, providing food boxes, whatever we need in that moment. We work very closely with like Dufferin County and multi other agencies. Very well supported by the OPP Community Safety Bureau. Brittany Murrow and Lisa Longworth are a huge support in terms of for the MCRT staff as well.
It's great to hear you're working so closely with so many partners. We had a guest on our last episode, Dr. Frank Sketchy, who's a forensic dentist, and he's turning 80 years old soon, and his big thing is that there needs to be multidisciplinary collaboration.
Absolutely.
So I'm sure he will be listening to every episode we do from now on because he was quite adamant that this is the way forward, and he's got a significant experience. If you care to listen to that, we actually had people writing in wanting to reach out to him who work in child protection services because he's such a wealth of knowledge and expertise. So I think this is a great kind of a follow-up episode talking about the multidisciplinary collaboration. So
nobody can do this alone, right? It takes a village. It does.
Couldn't agree with you more. So Michelle, you are a registered nurse. Often we hear of social workers working with police officers during crisis response together. Can you tell us maybe what the difference is between a social worker and a police officer working together and a nurse police officer working together in these situations, and maybe what some of the advantages of each is? And I assume both work pretty well. James mentioned in his podcast managing medication was a pretty big bonus, and access to health records. Can you elaborate on this for us?
Definitely. So Dufferin OPP decided to collaborate with Headwaters Healthcare, which is our local hospital here. So I I can't really speak to the social worker role. I think they're brilliant, and we often rely on, referring out to social workers as well. I know many of the teams across Ontario do utilize social workers. So I would say the benefit to our program is having that kind of co-collaboration with the hospital. I can access, let's say we're on our way to a crisis call. You are provided with the name of the person if it's available. So I can access health records to look at, previous assessments, if they are taking any medications, when those were last dispensed. Obviously keeping it, within confidential limits, right? Not to share with the officers, but it kind of helps me build a little bit of an understanding prior to getting on scene. So that is definitely helpful. It provides, doctor's information, someone, that we may need to contact at the time of the call. In terms of the hospital, we're working on a MOU, like a memorandum of understanding, for transfer of care, which is very helpful in terms of if we look at historically, officers could be tied up for, I've heard some say they were there their whole shifts guarding somebody at the hospital that was taken in. So when someone's taken or apprehended by police and taken to hospital, the officers have to stay with them. So we look at, wait times and that kind of thing at province-wide, right? Across the board for hospital times. Our kind of understanding with the hospital is the crisis assessment has been done prior to coming in. If we need to take somebody to hospital, which it does happen, the crisis assessment is done, so the doctor has that when we walk in the door. The understanding is that we get them seen as soon as possible. We actually come through instead of going through the waiting room. I'm a firm believer when somebody's in crisis, the last thing that needs to happen is them sitting in a waiting room with police by their side, right? Maintaining their dignity. So we come through the back way, which is where you would go, via paramedics or ambulance. We're triaged and often transferred directly into a room as soon as possible. And this allows the officers to get back on the road as quickly as they can. Saves tying them up, sitting and waiting, right? When we think about our loved ones out on the road or community safety, having the officers tied up in the emerge is definitely less productive than them being out on the road. So I think that is definitely a pro to our program here.
I think that's a great example. Speaking of examples, I was wondering if you might be able to share some success stories, obviously not compromising any privacy of anybody, but if you have any of those and you're willing to share, we'd be happy to hear them.
Fair enough. We have a lot of success stories. It's great to see. I mean, Dufferin is a very small community. Considering, the resources that we do have, MCRT has been tasked most recently. Our homeless population is definitely growing. We've got, I think, 14 different encampments that we've come across in Dufferin County. I'm going to say potentially 25 or more individuals in these encampments. Currently, we have, through working with these individuals and going out, building trust and rapport, we have got them connected with services. We have multiple people out of those encampments that are now housed or sheltered. Looking at, the cold weather is coming, so we take those as wins, and they're working with community partners, which is amazing.
I know James mentioned he thought around in 2023, he thought there was about 770 referrals approximately to external community agencies from the program. Like, to me, that's a big win. Sorry to interrupt you. Carry on.
No, not at all. Not at all. We actually looked up, just because you brought that up, we looked it up. So in 2024, and we're just approaching December. So MCRT alone has attended over 600 calls. Now that's on our shifts, not including like all mental health calls for the OPP in Dufferin. This year we have put out 1,539 referrals to date to community agencies. So that's a lot of referrals and a lot of people hopefully connecting with services.
And we're recording this on November 28th, 2024. So we're talking 11 months here.
Yes.
That's absolutely staggering.
I think that goes with, when we were first getting started, it was really just relationship building with some of the community partners and the key players. So it's definitely, it's grown. And it's exciting to know that many people have access services.
Wow.
It is.
Well, thank you to your whole team for everything you're doing. It's
thank you.
It's a lot of work. That's a lot of phone calls. That's a lot of following up. It's a lot of caring and kindness that you're showing the community. And I know James said kindness is the key. So clearly you're doing that. We also talked with James about stigma. And do you feel stigma is reduced with this MCRT program? You mentioned, the last thing a person in crisis needs is to be sitting in a waiting room with a uniformed police officer beside them. They probably don't really like having a uniformed police car outside their house either. So can you comment on that?
Definitely. So our MCRT team, the officer is in uniform. I do know some other teams are actually plain clothes. Both Jordan and he's obviously in his uniform. My vest, the vest that we wear says nurse. So having the cars outside the house, it can be, distressing to people. So we do ride in an unmarked vehicle. We do. Unless you come up close, then obviously you would be able to tell. I think that is a huge help. It is. Stigma has been huge around mental health for eternity, I would say. I think we're really making progress over the years to reduce that stigma. I'm kind of guessing back on a few years ago. I remember the stats for a person experiencing mental health in their lifetime was about 1 in 4, 1 in 5. And those stats have grown quite significantly to basically 1 in 2 now. So with all the community events around mental health and, social media, that kind of thing, people are really working hard to reduce that stigma, I think is great. When approaching somebody, I always say everyone has this entity about the police, right? People will say, I hate the police. And it's at the end of the day, these guys they really are there to help. But seeing, nurse across the vest, I think really has been effective because people are more apt to talk to nurses are known to be caring, right? So that's really a lot of our work in the community is trying to reduce that stigma with people.
I think it's very important. And I agree with everything you've just said there, Michelle. How do your shift schedules work, and kind of what are the MCRT coverage hours currently in Dufferin?
So currently I come in at 9. My hours are 9 to 5. We are funded to have, I think, 60 to 70 hours coverage in a week. That doesn't always happen based on just availability. So I would like to say I'm generally done at 5. I often am here till 10 o'clock, sometimes 3 in the morning. It really depends on what's happening that day. It does. Crisis doesn't only happen during 9 to 5, Monday to Friday, right? Any event can happen at any time. So often, Jordan and I worked almost a 25-hour shift not that long ago. So I'd like to say I'm working regular banker's hours, but it's sporadic. So, and most of the officers know, they can call me kind of on their own time if need be, just a consult or question.
It's pretty much available at any time. Is there 24/7 coverage, or is there kind of on the plan is, what are the coverage hours?
So generally 9 to 5, 10 to 6 is what we're scheduled for. And that's Monday to Friday, Monday through Sundays. It should be 7 days a week. Ideally, we would love to have another team come on and be able to provide round-the-clock coverage.
Mm-hmm. I think that would be great too, because crisis doesn't really have a time of the day, that's for sure.
Absolutely.
We referenced it earlier, that we like to ask people their 3 wishes for change. And I can gather what some of your wishes might be, but if you're willing, Michelle, we'd love to ask you your 3 wishes for change.
So I would say sustainable funding would be number 1. It would. I think probably continued, relationship building with the community. So, people don't think that the police are the bad guys, right? They are there. They're there to help. And I think that just goes with getting out in the public and, interacting with some of the events that we attend and that kind of thing. In terms of a third, probably another team. If we could have that round-the-clock funding, right, and coverage.
I'm hearing you need some more funding.
Absolutely.
You need some more team members. I have a quick question. And I know collective agreements came up there, like when we were talking with James, that, some of the community partners have like mandated hours that you have to work and stuff like that. And that could be a barrier to all this. Does that happen with you in the nursing profession?
In terms of for us, or for like
for you
partner?
guys, like is there any like things in collective agreements that you're a part of that actually say your working hours that becomes a barrier to kind of what is needed for the MCRT program?
So in our agreement, I think we have to have obviously so many hours between shifts. That can definitely be a barrier if you get stuck on, a barricaded person call, because you can be there for multiple hours. I mean, nurses work round the clock every day. So it's really, there's no, I don't think, major barrier to that.
Mm-hmm.
Yeah.
Well, we very much appreciate you talking with us, and I just want to hand it over to you for any last words or last thoughts. Is there anything that we haven't talked about that you would like everybody to know?
No, I'm very excited that to have this opportunity. I think one of the key messages is reducing the stigma. In being kind of integrated into the Orangeville detachment, pardon me, it's allowed, relationship building, not only with the community, but with officers on every platoon, where we know first responders at some point or another experience things that people don't necessarily want to talk about or see. And having that trusting relationship with somebody where they will come into my office and sit and talk. And, we've connected people on our own kind of crew to services that, they might not have reached out for before. So I think that's super important.
That's very good to know. I'm sure you're familiar with the Encompass mental health wellness program that the OPPA runs. And
yes, they're a fabulous resource.
Yeah, but the more people we have out there that we have a trusting relationship with as for our members is absolutely phenomenal. And you're right, our members, both civilian and frontline officers, and all of our members are exposed to trauma, and
every day.
It's a fact of life, and the more we can deal with it as we go on, the better. So thank you for helping with that.
Thank you.
I think that's about our episode for today. Thank you for being our guest, Michelle, and thanks to you and your team for all you do each and every day to help people.
Thank you so much for having me, Scott.
You're very welcome. You've been listening to registered nurse Michelle Marr from Dufferin County Mobile Crisis Response Team, talking about her role working with OPP officers collaboratively to effectively respond to and prevent mental health crisis calls. And please feel free to reach out to Emily and myself on email, communications@oppa.ca, if you would like to connect with Michelle, or if you have any ideas for future podcast episodes. For my host, Emily Brown, I'm Scott Mills, and we are proud to be your hosts of 10-5, the official podcast of the OPP Association. And when we started this podcast, I believe it was back in 2021. I may be wrong there. We did weekly episodes. We've now got over 130 episodes out there. You can find them on our website or on all major podcasting platforms, and they're all on YouTube now too. So please feel free to go back and listen to some of these editions. We've had some amazing guests. And about a year ago, we went to bi-weekly episodes, and in January 25, Emily and I are going to be assigned to a couple other projects here, and we're going to be doing monthly episodes for starting in January 2025 for an indefinite period. We may get back to the bi-weekly, but for the moment, we're going to be doing monthly. And I believe we're going to try and release those on the first Friday of the month. Like I said, it's on the podcast platform of your choice, whether that be Spotify, Apple, YouTube. It's also on our OPPA.ca website. Just go on there. There's a tab for podcasts. And until next time, thanks for listening, and stay safe out there.